As CEO of one of the world's leading hospitals for women and children, Doctor Iyabo Tinubu-Karch is pioneering state-of-the-art research to improve the health of the next generation. After a career at the cutting edge of geriatric medicine, the distinguished Nigerian doctor now leads a hospital supporting the very youngest members of society.
Hello, I'm Doctor Iyabo Tinubu-Karch. I am the CEO of Sidra Medicine.
In Qatar and throughout the world, Dr. Iyabo's vision for personalised healthcare is inspiring clinicians and patients alike. Dr. Iyabo, thank you so much for inviting us to take a look behind the scenes here at Sidra Hospital. And we're sat in one of your healing gardens. I have to say, it doesn't feel much like a hospital, but I guess that's part of what makes Sidra so special.
The healing garden is a place of serenity. It's part of the overriding vision of the organization to provide care, comfort, and healing in an environment that engenders serenity. Well, Sidra is a very unique institution. It's different. It's not like your traditional hospital. We're the sole provider of tertiary care, meaning we take care of the sickest of patients. We are passionate about the people we bring onto the organization, our nurses, our physicians, our techs. We have a research institute that excels in genomics. Another example is our Sidra's genomic program. In collaboration with Hamad Medical Center, we have looked at the genes of more than 40,000 individuals, one of the top in the Gulf region. And by studying this, we can begin to understand specific diseases through genetic makeup of people in the Middle East. Sidra is moving in the direction of standing out as an expert in pediatric rare diseases.
And I know you have been able here at Sidra to support children that have been affected in war zones around the world with operations, with mental health support. Can you tell me a bit more about how you and your teams have been helping?
First and foremost, as a healthcare organization, we are humanitarian in what we do. For example, over the last several months, we've been taking care of a number of Gaza patients. Sidra Medicine has been the primary pediatric institution to take these children, some with horrific injuries, polytrauma, who have required multiple surgeries. We also have our mental health team who are also providing crisis intervention and support to these children. Nothing makes us happier than being able to see our patients feel comforted, feel safe, and to heal. And that is why part of my vision is to redefine what the delivery of care means. Because we have to understand that people come to these environments when they're at their most vulnerable. So one of the primary things that we have to do as a priority always is to make them comfortable, to provide solace, irrespective of the outcome of the medical condition.
You must have been on a bit of a journey yourself in terms of becoming a leader. Can you tell us a bit about that?
During training and practice, I always gravitated to where there were problems. I was always trying to fix problems. I love relationships with people. I think I was perfectly positioned to be a physician, a practicing physician, because of my love for wanting to fix things and community. And I think it's helped me be a better leader and a better doctor. But you have to believe in where you're going in order to inspire people. And I believe that really the success of the care of any individual rests on your ability, first and foremost, to make them feel safe and cared for. And I think we do that well here at Sidra.
Well, just a short drive from Sidra, we've come here to Education City Golf Club. Tell me about your love for golf. Where does that come from?
It comes from my mother, but more importantly, it's a great time for me to unwind. During challenging days, you're likely to find me here at the end of the day. It's taught me patience and perseverance and enhanced my focus. The thing about golf is you have to be aligned from a mental and a physical perspective, otherwise it doesn't work, right? And I think it's the challenge of the game that really attracts me to it. I think for golf, it's learning and improving constantly, and that really resonates with me, so I love it.
You mentioned your mother, and she's a prominent figure in Lagos, a role model to many, many people.
Mm-hmm.
What sort of impact has she had on your approach to work, to life in general?
You know, the values and principles that my mother lives by, I've absorbed into my leadership. She will emphasize over and over again that you will never be happy or successful if those around you aren't happy or successful. And that's how I look at myself personally and professionally, especially in an organization of close to 4,000 people. She's given the tools and resources always to empower people that she's been around. She is very active in the community, takes care of widows, orphans, women. She supplies them with food, and her resilience and determination really made a mark on all of us.
And you've been doing some incredible work in Nigeria. You've been helping to improve girls' education. Can you tell us a bit about that?
I also work with my brothers. In northern Nigeria, we're working with the Ministry of Health to see how we can facilitate education of the 20 to 30 million people, young people who are uneducated. So we're looking for avenues. I mean, Nigeria is it's a huge country, hundreds of millions. So there's a lot of work to be done. Yeah.
What does the future look like then? What are you focused on over the next couple of years?
I'm focused on Sidra over the next couple of years. There's also incredible opportunity in women's health innovation. No matter where you go in the world, women's health is forgotten. We have high rates of heart disease, high rates of metabolic diseases. The Middle East is no exception. So one of my goals is to build an innovative, integrative women's health and well-being institute and invite the experts from around the world, merging Western and Asian medicine. I'm a scientist, so it has to be evidence-based.
Well, look, I'll let you take your shot, but before I do, I just want to say thank you so much.
Thank you so much. Thank you. You should come and play.
I will.
You should take lessons.